Let me start with a blood test that almost nobody talks about, yet it may be one of the most important indicators of your future health: fasting insulin. Most people assume that if their blood sugar is normal, everything is fine. They go to their annual checkup, get a glucose test, maybe an A1C test, and if the numbers come back within range, they breathe a sigh of relief. But what many people don't realize is that blood sugar is often the last thing to change. Your body can struggle for years before glucose levels finally rise enough to trigger concern. Think of it this way. Imagine you see smoke coming from a building. The fire has already started. Blood sugar is often the smoke. Insulin resistance is the fire. Insulin is the hormone that helps move sugar from your bloodstream into your cells where it can be used for energy. When your cells begin resisting insulin's signal, your body responds by producing more and more of it. This compensation can continue for years, sometimes even decades. During that time, your blood sugar may still appear perfectly normal, but your insulin levels can be climbing steadily behind the scenes. That is why fasting insulin is so valuable. It allows us to detect metabolic trouble long before diabetes develops. It gives us a glimpse into what is happening beneath the surface. And this matters because elevated insulin is not just about diabetes. High insulin levels have been linked to weight gain, stubborn belly fat, high blood pressure, increased inflammation, cardiovascular disease, and even cognitive decline later in life. In many ways, insulin resistance sits at the center of some of the most common chronic diseases affecting adults today. What makes this especially frustrating is that many people are doing what they believe are all the right things. They're trying to eat healthier, they're exercising occasionally, they're watching their weight, yet they feel tired after meals. They struggle with cravings. Their waistline keeps expanding despite their efforts. These can all be signs that insulin is working overtime. I often tell people that prevention is most powerful when it happens before symptoms become obvious. Once diabetes is diagnosed, the process has already been underway for years. But if elevated fasting insulin is discovered early, lifestyle changes can often make a tremendous difference. Improvements in nutrition, physical activity, sleep quality, and stress management can help restore insulin sensitivity and reduce future risk. This is not about creating fear. It is about giving yourself information. The earlier you understand what your body is telling you, the more options you have. You can make adjustments while your health is still largely under your control rather than waiting until a serious diagnosis forces action. The goal is not simply to live longer. The goal is to maintain energy, independence, mental sharpness, and quality of life as the years go by. And sometimes the difference between reacting to disease and preventing it comes down to having the right information at the right time. A fasting insulin test may not be part of your routine checkup, but it can reveal a story about your health long before the first warning signs appear. Now, let's move to another blood test that rarely gets the attention it deserves, yet it may reveal one of the biggest hidden threats to your health: chronic inflammation. The test is called high sensitivity C-reactive protein, or HSCRP. One of the challenges with inflammation is that many people misunderstand what it actually is. When most of us hear the word inflammation, we think about a swollen ankle, a sore knee, or redness around a cut. That's the kind of inflammation you can see and feel. But there is another form that is much more dangerous because it operates quietly, often without any obvious symptoms. This type of inflammation can smolder inside the body for years. You may feel relatively fine. You may go to work every day, spend time with family, and carry on with your normal routine. Yet beneath the surface, inflammation may be gradually damaging blood vessels, stressing organs, and creating an environment where chronic disease can thrive. That is why HSCRP is so valuable. Unlike many routine blood tests, it is designed to detect low levels of systemic inflammation throughout the body. It gives us a glimpse into a process that often remains invisible until significant damage has already occurred. Think of inflammation as a small fire. In the short term, fire can be useful. It helps the body heal injuries and fight infections. But when that fire never completely goes out, it begins to cause problems. Day after day, month after month, year after year, it can slowly contribute to the development of heart disease, stroke, diabetes, certain cancers, and even conditions affecting memory and brain health. What makes this particularly concerning is that chronic inflammation often develops because of modern lifestyle habits that have become common. Poor sleep, chronic stress, excess body weight, lack of physical activity, smoking, highly processed foods, and uncontrolled blood sugar can all contribute to an inflammatory state. Many people are unknowingly feeding this process every day. I have seen individuals who were shocked when they learned their HSCRP levels were elevated. They assumed they were healthy because their cholesterol looked acceptable and their routine blood work appeared normal. Yet this single marker revealed that something deeper was happening. The beauty of this test is not that it predicts a specific disease. Instead, it provides a broader picture of how much stress the body may be experiencing internally. It acts almost like an early warning system. It tells us to pay attention before symptoms become impossible to ignore. And the encouraging news is that inflammation is often highly responsive to lifestyle changes. Improvements in nutrition, regular movement, better sleep habits, stress reduction, and maintaining a healthy weight can all help lower inflammatory markers over time. In some cases, these changes can produce remarkable improvements in overall health and well-being. This is why I believe HSCRP deserves far more attention than it receives. It shifts the conversation from treating disease to preventing disease. Instead of waiting for a heart attack, stroke, or serious diagnosis, it allows us to identify a risk factor while there is still time to intervene. Health problems rarely appear overnight. More often, they develop quietly in the background, sending subtle signals long before symptoms emerge. The HSCRP test helps us hear those signals while we still have the opportunity to change the outcome. Sometimes the most dangerous health threat is the one you cannot feel, and the most valuable test is the one that reveals what has been hidden all along. Now let's talk about a blood test that has the potential to completely change the way you think about heart disease risk. For decades, we've been taught to focus on cholesterol. Most people know their total cholesterol number. Some know their LDL, often called the bad cholesterol, and their HDL, the so-called good cholesterol. These numbers have become the standard way of evaluating cardiovascular health. But there is a growing recognition that traditional cholesterol testing doesn't always tell the whole story. Have you ever heard about someone who had normal cholesterol levels and still suffered a heart attack? Unfortunately, it happens more often than many people realize. People are sometimes told that everything looks fine, only to experience a serious cardiovascular event years later. This is one reason why researchers and many preventive health experts have become increasingly interested in a marker called apolipoprotein B, or ApoB. To understand why ApoB matters, imagine you're looking at traffic on a highway. Traditional cholesterol tests measure how much cholesterol is being carried through the bloodstream, but ApoB measures something different. It measures the number of particles transporting that cholesterol. Why is that important? Because it is not simply the amount of cholesterol that creates problems. It is the number of particles that have the opportunity to penetrate artery walls and contribute to plaque buildup. Each potentially harmful lipoprotein particle carries one ApoB protein. As a result, ApoB gives us a more accurate count of the particles that may be involved in the development of atherosclerosis. Think of it this way. Two people can have identical LDL cholesterol numbers, yet one may have far more cholesterol-carrying particles circulating in their bloodstream. That individual may face a significantly greater cardiovascular risk, even though a standard cholesterol panel suggests they are in the same category. This is why ApoB has attracted so much attention in recent years. It provides a clearer picture of what is actually happening inside the arteries. Instead of focusing solely on how much cholesterol is present, it helps us understand how many vehicles are delivering that cholesterol to places where damage can occur. What makes this especially valuable is that heart disease often develops silently. Plaque can accumulate over decades without causing symptoms. Many people feel perfectly healthy while these changes are occurring. They have no warning signs until a blockage becomes severe enough to trigger chest pain, a stroke, or a heart attack. That is why better risk assessment matters. The goal is not to create anxiety over every number on a lab report. The goal is to gain a more complete understanding of cardiovascular health. ApoB can help identify individuals who may benefit from earlier intervention, even when traditional cholesterol markers appear acceptable. And just like the other tests we've discussed, this information is most useful when it leads to action. Lifestyle choices remain incredibly powerful. Nutritious eating habits, regular physical activity, maintaining a healthy weight, managing blood sugar, reducing inflammation, and avoiding tobacco all play important roles in protecting the heart. The value of ApoB is that it can help guide those efforts by providing a more precise picture of risk. When it comes to heart disease, waiting for symptoms is rarely the best strategy. By the time symptoms appear, the process may have been underway for many years. Knowledge gives us the opportunity to act earlier, make better decisions, and potentially avoid life-changing consequences. As we continue exploring blood tests that can reveal hidden risks before they become serious health problems, I want to introduce one that many people have never even heard of. Yet it has important implications for both heart health and brain health. The test measures a substance called homocysteine. Now, if that name sounds unfamiliar, you're not alone. Homocysteine rarely comes up during routine doctor visits, and it is not typically included in standard blood work. But despite its low profile, it may provide valuable insight into what's happening inside your body long before symptoms begin to appear. Homocysteine is an amino acid that is naturally produced during normal metabolic processes. Under healthy conditions, the body efficiently converts it into other useful compounds with the help of certain B vitamins, particularly vitamin B6, vitamin B12, and folate. When this system works properly, homocysteine levels remain within a healthy range. The problem begins when homocysteine starts to accumulate. Elevated levels can place stress on blood vessels and contribute to damage within the circulatory system. Over time, this may increase the risk of cardiovascular disease, stroke, and other conditions involving the heart and blood vessels. What makes this particularly concerning is that these changes can occur silently. You may not feel any different. You may not notice any warning signs. Yet the process may already be underway. Think of your blood vessels as a network of highways transporting oxygen and nutrients throughout the body. When homocysteine levels remain elevated for extended periods, it can be like gradually roughening the surface of those highways. The smoother and healthier the vessels remain, the easier it is for blood to flow efficiently. But when damage accumulates over time, problems become more likely. The story doesn't end with the heart. Researchers have also explored the relationship between elevated homocysteine and brain health. Some studies have linked higher levels to cognitive decline, memory difficulties, and an increased risk of certain neurological conditions as people age. While homocysteine is certainly not the only factor involved in brain health, it may represent another piece of a much larger puzzle. This is one reason why I find this marker so fascinating. It sits at the intersection of two of the greatest health concerns facing older adults: protecting the heart and preserving the mind. Another valuable aspect of homocysteine testing is that it can sometimes uncover nutritional issues that might otherwise go unnoticed. A person may appear healthy on the surface and still have suboptimal levels of key B vitamins. Because these nutrients play an essential role in homocysteine metabolism, elevated levels may serve as a clue that the body is not getting what it needs to function optimally. And here's the encouraging part. Unlike some risk factors that are difficult to influence, homocysteine levels can often improve when the underlying causes are identified and addressed. Better nutrition, adequate intake of important vitamins, and targeted lifestyle improvements may help support healthier levels over time. The larger lesson here is one we've seen repeatedly throughout this discussion. Serious health problems rarely appear without warning. The body often sends signals years before disease becomes obvious. The challenge is that many of those signals are invisible unless we know where to look. Homocysteine gives us another opportunity to look beneath the surface. It allows us to identify potential risks while there is still time to act, rather than waiting until damage has already occurred. The most powerful health decisions are often made long before symptoms ever appear. As we come to the final blood test on this list, I want to talk about something that many people assume is already being checked routinely. Surprisingly, that is often not the case. The test measures your vitamin D level, and while most people associate vitamin D with bone health, its influence extends far beyond preventing fractures. In fact, vitamin D affects nearly every system in the body. For years, vitamin D was viewed primarily as a nutrient that helps the body absorb calcium and maintain strong bones. While that role remains critically important, research has revealed that vitamin D receptors exist throughout the body, including in the immune system, muscles, brain, and cardiovascular system. This means that vitamin D is involved in far more processes than many people realize. What makes this test particularly important is that deficiency is incredibly common. Many individuals have low vitamin D levels without experiencing obvious symptoms. They go about their daily lives feeling tired, lacking energy, or struggling with aches and pains, never suspecting that a simple deficiency could be contributing to how they feel. One reason vitamin D deficiency is so widespread is that modern lifestyles have changed dramatically. Our ancestors spent much of their time outdoors, where sunlight naturally stimulated vitamin D production in the skin. Today, many people spend the majority of their day indoors. They commute in vehicles, work inside offices, and return home after the sun has already begun to set. Even when outdoors, sunscreen and protective clothing can reduce vitamin D production. As a result, deficiency can develop quietly over time. For older adults, this issue becomes even more significant. As we age, the skin becomes less efficient at producing vitamin D from sunlight. At the same time, maintaining muscle strength, balance, and bone density becomes increasingly important. Low vitamin D levels have been associated with muscle weakness and an increased risk of falls, both of which can have serious consequences later in life. But the impact may go even further. Vitamin D plays a role in supporting normal immune function. Individuals with low levels may not realize that this nutrient helps regulate important immune responses throughout the body. Researchers have also explored connections between vitamin D status and mood, cognitive function, cardiovascular health, and overall well-being. While vitamin D is not a miracle cure, maintaining healthy levels appears to be an important part of supporting long-term health. What I find most remarkable is how often this issue goes unnoticed. People may spend years searching for answers to fatigue, reduced strength, or a general sense that they do not feel as vibrant as they once did. Yet, they may never have had their vitamin D level measured. That is why testing matters. The purpose of testing is not simply to collect more numbers. It is to uncover information that can help guide better decisions. If a deficiency is identified, individuals can work with their healthcare provider to determine appropriate strategies for improving their levels through lifestyle adjustments, nutrition, sensible sun exposure, or supplementation when appropriate. When you step back and look at all 5 tests we've discussed, a common theme emerges. The most effective healthcare is often proactive rather than reactive. It focuses on identifying risks before they become crises. It seeks answers before symptoms become severe. It gives people the opportunity to make changes while they still have the greatest chance of influencing their future. Sometimes the simplest test can reveal the opportunity that changes everything, and knowing your vitamin D level may be one of those opportunities.